So I have the pleasure to invite Dr. Hannah Woopen from Clinic for Gynecology of Charité University. Welcome.
Thank you very much for the invitation.
And
I feel very honored to be here.
Yeah. Important argument, which is the long-term survival with gynecological cancer, which seems to become a reality in those days.
Luckily,
thank you.
Yeah, thank you. Very nice introduction. So my name is Hannah Woopen. I'm a gynecologist and researcher from here in Berlin. It's very nice to be in my hometown, actually, and to give all these talks this week. And yeah, it's amazing. A few years ago, no one was talking about survivorship and long-term survivorship. So there's really something going on, and that's very good that you take part in it and that you spread the information to your countries and to all the patients, because the data actually is really motivating. So cancer becomes more and more a chronic disease. Worldwide, we have 14 million new cancer diagnoses each year. And already in the Western world, there are more than 65% of cancer patients who survive longer than 5 years. And in Germany, for example, we have 4 million cancer survivors showing the huge amount of patients who are surviving cancer. And for the gynecological cancers, it was very heterogeneous. Someone was talking about a cancer survivor after just a few months after chemo, or after 2 years, 5 years, 8 years. It's difficult to compare the data between the trials. It's very good that the GCIG, which is the Gynecological Cancer Intergroup, that's like the head of all gyne-onco study groups worldwide, and we were sitting together and really discussing what is a long-term survivor, how shall we define it, for our clinical consensus. And we said survival of at least 5 years after initial diagnosis defines long-term survival in gynecological cancer. Of course, this is different in prostate, in lung, and colorectal cancer, but for gynecological cancers was a definition of 5 years. And I'm sometimes saying this is like my second PhD paper. We wrote a GCIG consensus guideline on long-term survivorship in gynecological cancer, which is really important for us also as physicians, because it really deals with all the long-term side effects. It defines long-term survival with gynecological cancer, and it's really a guide, or a recommendation, a guideline for physicians, but also interesting for patients to read. And you're going to get the slides in the end, and there's also a survivorship care plan template, which you can download for your own patient records, which you can use. Defining long-term survival with 5 years after initial diagnosis, that's quite a basket of patients. It's a very heterogeneous group. On the one hand, we have the cured patients who have never experienced any recurrent disease. On the other hand, we have patients after recurrences, and we also have patients with a recurrent disease right at this moment who are under treatment. And just to give you a few popular examples, Kathy Bates, a very important, very popular Hollywood actor, or the middle Cody Smallder from How I Met Your Mother. Most of them might know them, and there are so many long-term survivors now, which are also going to the. And of course, quality of life is rising with survival years. This is an analysis from the Netherlands with all cancer survivors from different entities, and you can see that in all domains of quality of life, the quality of life is increasing with the years, and also is the health status. And this is data from our Expression 6 survey, where we have 1,600 long-term survivors with ovarian cancer from 14 countries worldwide, and we asked them, how do you rate your health status? And 1 was very good, 2 was good, 3 was moderate, bad, or very bad was 4. It was 5. And you can see that around I have a very good or a good health status, and there are only 20% saying I have a very bad or bad health status. So altogether, the quality of life and the general health status of our long-term survivors in the world it's pretty good, and of course it's rising with the survival years. So the longer my initial diagnosis was ago, the better is my health status. And of course, if I'm under treatment at the moment, if I have recurrences, my health status is worse, of course, than if I had no recurrence at all. And so why how can we improve the health status, and what we can see that around 50% of our patients still, in fact, number one is fatigue, which is very interesting because we are not talking so much about fatigue in our follow-up clinics, actually. And also our memory problems, concentration difficulties, forgetfulness, polyneuropathy. These are like the top 3 or top 4 of long-term side effects. And the good thing, they become better with the years. Side effects. And the good thing, they become better with the years. But what is also important, that there are long-term side effects who are not present during therapy or who are not present within the first years after initial treatment, but they come along with the survival years. For example, lymphedema. You don't have lymphedema when you're going out of the hospital, but you develop lymphedema later on. Or also peripheral neuropathy. About 60 to 90% have peripheral neuropathy during treatment, but then can still go on afterwards and then find a plateau. And there's so many new treatments. I mean, Professor Mirza just talked about so many new treatments. There's so many side effects we cannot talk about because we're not familiar with them. We're just learning now with all the clinical trials what side effects are developing with the years. And we have to be really aware because there are other side effects from immunotherapy than with chemotherapy. So we are learning as physicians. So yeah, be patient with us with the years. And I also already gave you the example of lymphedema. And you can see in the beginning, after the initial treatment, there's no one with lymphedema or very little one. And then it's like going up, it's rising. And then there's a plateau of around 20% with lymphedema. We really have to cope with it with the years. And have to cope with it with the years. And there's not so much to do about lymphedema, actually. So it remains at 20%. Another point, no one is really talking about is post-chemotherapy cognitive impairment, which is also known as chemo brain. And maybe it's not only chemo brain, but the cancer brain, because many have a lot of surgeries going on. Of course, the anesthesia is also playing a role. And we have a very, very motivated student in our university, and she really dealt 19 minutes with every patient, and she examined the short-term and long-term memory. And we could see that an 18% short-term memory is decreased, and also 23% it's a long-term memory impairment. And it really started with concentration problems. For example, I'm going to the kitchen. Oh, what am I doing in the kitchen? So you forget those daily things. And a lot of my patients are around memory problems. What is also very interesting if patients are still regarding themselves as a cancer patient. And there are more than 40% of this 1,600 long-term survivors worldwide who are saying, yes, I am a cancer patient. And of course, if I'm under treatment right now, if I develop recurrences, this is a higher rate of feeling cancer patient, but altogether, they're really more than 40%. And this, of course, has also to do with distress. And what we can see that if I'm relapse-free, of course, I have less distress compared to patients who are under therapy or who are experienced relapses But if you compare those long-term survivors having survived 5 to 10 years to those having survived more than 10 years, we can see that the distress remains the same. So even after 10 years, 15 years, 20 years, so the long-term survivor who survived the more or the most I've seen, and the distress really remains the same. So that we really, really have to do something because all these long-term side effects, they're really affecting our quality of life. And what is quality of life? Quality of life has an influence on survival. And I'm showing you two large trials, one in cervical cancer, the other one in ovarian cancer, where you can see the quality of life really has an impact on overall survival. So that's really something we have to do, where we can do something about it. So this trial from the California Cancer Surveillance Program with a median survival of 9 years after initial diagnosis, the patient with a better quality of life were surviving longer years compared to those with a diminished quality of life. And this could be also seen in ovarian cancer. This is very interesting because this is not a long-term survivor cohort, but was a cohort of ovarian cancer patients during initial therapy, during carboplatin and Taxol. And they had to fill out a quality of life questionnaire before each cycle of chemotherapy. And then they compared prospectively who is living longer, the one with a higher quality of life or with a diminished quality of life. And there you could see that already at cycle 4 of the 6 typical chemo, so the longer survival. So we're not only talking about quality of life in survivors, but we really have to start early from the beginning in order to improve survival of all our patients. And that's really the goal about learning about long-term survivors. We are learning so much for all ovarian or all cervical, all endometrial cancer patients, that we can really give to all of them. And if you're going to talk about quality of life, of course, we have to talk about secondary prevention or prevention. And to understand what we can prevent is why do long-term survivors die? And this is a very interesting trial with ovarian cancer from Canada, and they examined why are ovarian cancer patients dying. And yeah, this is a really, really impressive data, and they should show that when the first 15 years after ovarian cancer diagnosis, ovarian cancer was the main diagnosis, cause of death. But after that, and also with the survival years, all these other causes are gaining. For example, cardiovascular disease, falls, osteoporosis, secondary cancer. So if patients have a cancer diagnosis, cancer is like this one, so much more going on, so much more is affecting our health. So it's important not only to talk about cancer, but also to talk about all the other causes of death or all the other life-threatening diseases. For example, secondary cancer after ovarian cancer. We have 225 long-term survivors seen in Germany, and we asked or we checked our patient data to see how many developed secondary cancer, and it was 17.6%, and mostly they developed the secondary cancer after 6.5 years. And if I'm asking you now, how long is your usual follow-up? It's 5 years. What's going on after these 5 years? We all have this crucial 5 years where we have our regular, organized, very well-organized follow-up. But what's going on after these 5 years? And if secondary cancers develop after these 5 years, we really have to go towards lifelong follow-up. And breast cancer was most frequent secondary cancer. And there were quite a lot of patients I've seen in my survivorship clinic who don't go to regular follow-ups or don't go to regular screening programs. We have such a good health system. We have mammograms. So if you already had ovarian cancer, why are you not going to mammograms, for example? So this is very important really to keep in mind. There's not only gynecological cancer, but there's really more to health and quality of life. And this was also seen in cervical cancer. These are results from the Dutch Cancer Registry with more than 12,000 cervical cancer diagnoses. And again, 5.6 developed secondary cancer. They were mainly smoking associated. And they were more frequently after radiotherapy. And there was still an elevated risk after 10 years, showing again, lifelong follow-up is very, very important and not stopping after 5 years. And the European Heart Journal, which is like the patients, more than 3 million cancer patients, and they checked if they were dying from cancer or from cardiovascular disease. And for example, the endometrial cancer patient, which you can see in purple here, there were 113,000 endometrial cancer patients, and you could see that 17% were dying because of endometrial cancer. But you can see that 17% were dying because of endometrial cancer. But you can see that more than 15% were dying because of cardiovascular death. And of those dying from cardiovascular death, there were 73% dying from a heart attack. And this is really worrying because everyone is talking about cancer, but you can see that the risk of dying from heart disease is almost the same in endometrial cancer patient than because of endometrial cancer. So this is very important to talk about prevention. And what you can see here is that there's an increasing risk of death from heart disease with survival years. So you can see it shrinking in the first years. So what's going on in the first years? We're receiving treatment, we see doctors regularly, we go to follow-up clinics, but then it's rising again. And this is true for all, if it's breast, if it's melanoma, prostate, endometrial, bladder. This is really true for all entities, that cardiovascular risk is rising also with survival years. So really pessimistic on one hand, but we can do something again about it. And that's so important. Yeah, for example, this is a trial where they invested in patient empowerment and health competence in cervical cancer patients. And they all received the lifestyle counseling. And you can see they had lower depression levels, lower anxiety levels, and their quality of life was really changing after this positive lifestyle change. And this shows you that you can really do something about your health. And it's not only the cancer treatment, but it's so much more. And really, it's like a puzzle with so many little pieces which comes together. So it's not only the cancer treatment. And of course, patients are doing quite a lot. For example, this is again results from our Expression 6 survey. And you can see that more than 50% of our patients believe that sports have a positive influence on their course of the disease, on their cancer treatment, and they're also very active. Only 20% of our ovarian cancer long-term survivors are not physically active. And all the other ones are doing sports on a regular basis. And I think this is really impressive. I don't think that 80% of the whole population is doing regular sports. So we can learn a lot from our survivors, actually. And this is also true for those who've changed their nutrition after ovarian cancer diagnosis. I don't know if you're familiar with the ESMO patient guidelines. There are quite a lot of patient guidelines released, and there was one released this year for survivorship. And it's really worth looking into it. I mean, for all the cancer entities, but it's mostly true for all ovarian or for all gynecological cancer entities. And one of the first sentences in this guideline is all survivors should be encouraged to achieve and maintain a healthy lifestyle. So, of course, what's a healthy lifestyle? To begin with, the well-balanced diet. You don't need to become vegetarians now or vegans. Eat what you want. It's a quality. You don't need to become vegetarians now or vegans. Eat what you want. It's a quality of life. Eat what you like, but of course it should have a lot of fruits, a lot of vegetables, no processed foods, reduce the amount of meat, for example, and also enhance your regular physical activity. And this shows that by enhancing your physical activity, if you do sports on a regular basis, and also quality of life, by a better nutrition, by a positive physical activity, you can really enhance your quality of life. And I could show you that a better quality of life is also resulting in a better survival. So this is very important. Then stress in a better survival. So this is very important. Then stress reduction, avoid smoking. I could show you that especially in cervical cancer, secondary cancer was more prominent in patients who were still smoking. Minimize alcohol intake, maintain or achieve a healthy body weight. You don't have to become models now. This is very unhealthy to be too, actually. It's better to have normal weight or a little bit overweight. So don't start with too many diets. There's also no special cancer diet that we can recommend. It's a balanced diet. And get all recommended vaccinations. So in our survivorship clinic in Berlin, we are asked for recommended vaccinations. So in our survivorship clinic in Berlin, we are asking all our patients about their vaccinations. And there are quite a lot who don't get their yearly flu shot. There are so many who don't have their tetanus vaccine every 10 years. So this is really the basis. We're having like immunotherapy, big cancer treatments, but the basis is really healthy lifestyle. And healthy lifestyle also includes recommend vaccinations, take part in recommended screening programs, and also do follow-up visits, not only in the first 5 years, but really on a lifelong basis, and of course, manage those long-term side effects. There's so many patients who still suffer from fatigue after 5, 10, 15 years, and they say, oh my God, this was my wish to go back to the East Sea, to make holiday at the sea, and I'm so tired, I don't know how to do my daily routine. And those are the patients we can really help by a training plan, for example, survivorship care at once, but go in small steps, and then you can really manage long-term side effects and enhance your quality of life. So this is really important. And the big question is now, who is dealing or who can care for all these survivorship things? And it's really, really challenging because many long-term survivors have a very long story of their disease. So these patients usually take longer time than the usual follow-up patient. It's very, you can't really do that in your normal gynecological follow-up, or for the general physicians, it's always very hard to deal all with the survivorship issues. And sometimes you don't know, is it from cancer, from another health status, so it's very complicated. And this is why we recommend that you go to special survivorship clinics. And we have such a survivorship clinic in Berlin, for example, where we really screen for long-term side effects. We diagnose them and treat them, and we're really promoting physical and psychological health and also an information platform. If you go to self-advocacy groups or to a self-health group, they're mostly patients who are within their first years of diagnosis, and there's not a lot of information on survivorship, on long-term survivorship for patients, and also to do a networking to find an information platform for long-term survivors. And the survivorship care plan is also very crucial, because I showed you it's about finding the recurrences, vaccinations, screening programs, sports, lifestyle issues, a summary of all medical cancer history. So it's always nice to have a plan, to have a document which you can take to your doctors, and also which is very interdisciplinary. Of course, I as a gynecologist, I am not the specialist for dealing polyneuropathy. Of course not. Yeah, so it's a big team. It's like a house, and we're all into this house and treating. Care plan is very nice to have at hand. And for example, I can all recommend you to download the template from the GCIG guideline I was mentioning earlier on. There's a template as a Word document, and there you can comprise all your health information together. It's in English, and I'm sure it's possible other languages. And this is open access, so if you get the slides later on, you can download the template and put in your cancer or your history. And that's it from my side. I'm thanking all my patients. We're learning so much from you, and this is, we have 1,600 ovarian cancer survivors now for the expression 6, and this really, really helps us to understand all these health issues, and we're really using this information to distribute to all the cancer patients we have. So thank you very much again, and thank you that I can be here. And I'm really open for your questions.
Thank you to you. It was really, really interesting and really new, mainly for the country I represent, which is Italy, but the idea to have a survivorship clinic, it's great. So I think there will be questions from the room.
I hope so. I actually spared a few minutes on this talk in order to have time for the discussion. Yeah. Oh yeah, of course. I go back.
Could you come to the microphone? So we all can hear from you?
So thank you very much, because it was a very important issue. And I think talking about diagnosis, treatment, but after treatment period and secondary, tertiary prevention is always problematic. And now I just want your advice. Maybe we just opened onco-rehabilitation program at National Rehabilitation Center, where I am clinical director. So for me, it's kind of new and very important project. And how do you think, if we will take this model you have, because it's kind of same, physical rehabilitation, psychosocial, and medical control, follow-up to say so, to prevent other diseases like neurological, cardiovascular, and so on. Can we take the same model, because we can't now rename our project, but it's kind of, again, survivorship care plan, kind of. Can we do it?
The template is there, so you can really just download it.
Yeah, because authors writes just, okay, thank you.
Because if you access the Cancer Treatment Reviews homepage from the journal, it says highlights in this issue, and it's the first highlight mentioned actually in the November issue. So you can just download it, yeah.
Got it, thank you so much. And I wish you success, it's really great idea. So much. And I wish you success, it's really great idea.
Thank you very much. You're going to get the slides.
If there are no, one question, okay.
Thank you. I was just curious, how about whether you measure things like work or being active as a patient expert, because on one of the slides you say stress reduced, but I, and maybe others here, always have the discussion, why are you working so hard? Why are you working anyway? And I feel that it helps my survival. But I don't see it in slides or in studies.
Yeah, and so we are assessing very much of social information, and many of our long-term survivors are still working. And I think working can, of course, be stressful, but working is also normal life. And this is very important for many of our patients. And we advise younger patients. We have a medical student at age 25 who's still working, yeah, or have teachers who are still working. So really advise going on with your work, yeah. And it's also a financial issue, of course, because the first 5 years, at least in Germany, you're paid by the government. At least in Germany, you're paid by the government.
She's doing outstanding work, so she's really a fighter for cancer survivorship clinic, so let her not go out.
Exactly.
I have to go to the closing ceremony.
Thank you very much. The Professor Ziholi is my mentor. I've got to know him 14 years. Thank you very much. So it's also a financial issue, and also just to keep your brain going on. Yeah, it's not very good you have the cancer diagnosis and then it's just cancer in your head all the time. There's so much more to live for, yeah? And so go on with working, do your hobbies, and maybe just on a reduced levels. And of course, there are certain times if you have a recurrence that you have to reduce all your activities, but it helps you to gain back your strengths and also to stay mentally